What lessons can medicine learn by listening to those who live it every day? What happens when patients advocate not just for themselves, but for others like them? The stories that shape the future of healthcare are the stories we tell today. This is the Patient Perspectives Podcast. Hello and welcome back to the Patient Perspectives Podcast. My name is Lauren Scholler and I am joined today by Ashley Spalla, who is an Army veteran with 7 years of service. She has experience in research through working in biology labs as an undergraduate and genetics research in Down syndrome. She's an aspiring researcher as well as an avid endurance athlete with a love for adaptive sports like downhill skiing, wheelchair basketball, and push rim racing. She loves Aussie Shepherds and is a semi-professional artist that specializes in 2D portraits. During her senior year as an undergrad, she injured her hip while training in Army ROTC, which led to a diagnosis of hip dysplasia in January 2009 at the age of 21. At that time, education and awareness or any information on hip dysplasia was extremely minimal. She ended up having surgery, a right hip periacetabular osteotomy, or PAO, with an arthroscopy in June of 2009, but it ultimately was performed incorrectly. To date, she's had over 29 hip surgeries, 50 total surgeries and counting, and uses a wheelchair for mobility. Ashley uses her hip journey as motivation to raise awareness, educate others, and promote research to further the treatment and advancement in hip disorders. She plans on pursuing further medical training and education in physician assistant school, and she continues to challenge herself mentally, artistically, and physically, even if it means doing it from wheels. Ashley, thank you so much for being here.
Thank you so much for inviting me.
Absolutely. Now, Ashley and I know each other through Miles for Hips. If you heard the episode with Nancy Muir on participatory medicine, Nancy Muir was kind of the founder and the visionary behind Miles for Hips, and now Ashley and I have been on the education and information board for at least a few years. And Ashley is such a strong advocate and a wonderful person to work with and to learn from. So I'm really excited for this, Ashley.
Thank you. I am too.
Can you start by sharing about yourself, anything related to your diagnosis, experiences as a patient, and background that would be important for listeners to know?
The biggest thing for me, like from my experience, was the lack of education and awareness that I had, not only personally, but what I ran into from doctors and physicians and surgeons as well. I went from my initial diagnosis, which I got pretty quickly, it was hip dysplasia, but I didn't get to the correct surgeon until after I was already had a PAO done incorrectly by a surgeon who wasn't properly trained. It took that like course of treatment to get to researching, to get to out to Boston Children's to Dr. Michael Millis, to then get to someone who is notably and very deeply involved in the hip community to properly be educated and aware. And that's what really took it for me, that people were not getting educated and aware and awareness of this condition in a proper manner. Um, and when I brought that up to the surgeon, when I went back to the surgeon that I originally saw, I was like, just to let you know that this is what happened, just so other patients know this for the future. He's like, well, I'll think about it. And it was just such a disheartening feeling to know that they didn't want to inform their patients of such an important feature and let I was like, that's not your decision. That is the patient's decision. You need to give the patient all of the information, and the patient needs to decide that. That is not for you to decide and make that decision for us. That is for us to decide. And it was just so disheartening to know that, like, Dr. Clohissy was 3 hours away, or Dr. Zaltz was 4 hours away. And I could have gone to either one of those great surgeons. And instead, I had a screwed up surgery because my surgeon wasn't aware, and the other surgeon did not want me to know because he didn't think it was relevant.
So this brings up such an important topic, which is that, first of all, I think that medical professionals should be lifelong learners. And part of that is continually growing your mindset when there's new information available, and also being open and honest with patients about what has happened, what the diagnosis is, what the treatment options are. And when you look at hip dysplasia in particular, in the last 20 years, the amount of information that we have now compared to then is huge. And if you were to Google hip dysplasia, even probably 10 years ago, you would find a lot of information about hip dysplasia in dogs. Even still, you can go online and Google hip dysplasia, and you have to make sure that you're looking at human x-rays because some of them will have a tail. And so, certainly, when you think about the resources and just the education and awareness that we have now for hip dysplasia compared to when you were going through your diagnostic journey with it, we've made a lot of progress, but certainly that must have been challenging navigating your diagnosis at a time when there was not a lot of awareness and education, like you said, even amongst other medical professionals on how to manage it appropriately.
No, and like now we have a couple resources for at least the patients. We have a large Facebook group. We have Miles for Hips. We have some things that are searchable on the web. There was nothing. You could not you literally could not find anything online. You could find some stuff on dogs pretty much, and that was it. And it's changed over the years, which I am so happy to see, but I want to see it change more. And I would like to see it, as you I'm sure would love to see it change even more, to where it is something when you walk into a pediatrician's office or when you walk into an orthopedic's office and you're like, I have hip dysplasia, and they're like, I know where to send you.
Absolutely. I do feel like a lot of that will change, and there's a lot of hope for like more awareness and education on it, especially now that many large academic institutions have hip preservation programs, which I think is something that you didn't necessarily see probably when you were going through your diagnosis. Having a dedicated hip preservation team who only specializes in these hip dysplasia and other types of complex hip conditions, that certainly helps to like point patients more towards more appropriate treatment.
Oh, absolutely. And even from I had my good hip done in, I think 2015, like 9 years ago. And I think of even all the changes that have happened since then and how much has changed, even though things are still going really well for it, how much like the hip community has continued to change and what the girls talk about and the guys talk about in the group. And it's just amazing to see everything continuing to change. Some of the stuff with incisions kind of shifting or different approaches or some things getting smaller or just all these little nuances to the surgery that continue to change, and like social media being such a big part now, with research coming up, with some of the studies coming up, out of some of the different institutions, um, that a couple of us have been a part of. And I know you've seen a couple of the recent ones that have come up. But it's fascinating to see that. And it's just really nice when we get that interaction, um, and that movement. So it's really nice.
It really is. I will put some links for these papers that you're referencing, but one of them that was just published recently by Dr. Wells at Baylor about social media and the experience of patients undergoing hip dysplasia treatment and the role of social media. I think it's a really interesting piece, and it's something that we're going to touch upon later, which is the role of peer support in one's journey as a patient, especially through hip dysplasia care. But making decisions about surgery or treatment can be daunting and very overwhelming. So, how did you approach these decisions for your care, and what do you wish providers understood about the emotional side of the decision-making process?
For me, and so much, and I've had so many surgeries, it becomes like a pro con list almost. Um, it has to be a quality of life improver. It has to be something that I'm willing to put myself through that is going to improve quality or function of life. That it has to be worth more than like 50% improvement or function or pain relief to be worth going through that torture or whatever it may be to do that. So I kind of make the pro con list in that regards, and that's kind of the top of the function like idea that this must occur. And if it's not worth these things, if the tipping scale does not tip in this direction, it's not worth it to me. Um, and then I have to obviously include like my family and my and those caretakers around me and consider those factors. Um, but that's really like how I consider when I think about like hip surgeries. I didn't when I initially started, I was just like, oh, my hips really hurt. This is what I have to do to get back to playing sports and, you know, got to get back to doing this. I'll be out for a little bit and then I'll be back. And I had no idea what I was getting myself into. Absolutely no idea. And now I really have to kind of think and sit down and make that decision for myself that if this isn't really going to be something that's going to improve my quality of life or function, then it's not something that I'm willing to risk the consequences of like infections, all the side effects that can happen because I've had so many of those. I feel like if they have occurred, they shall have occurred. Um, so yeah, that's just kind of how I deal with that. And then on the second point in regards to what I wish physicians knew about surgery and the emotional toll, I wish they knew. I know they can't understand what it's like to be a patient unless they are a patient. And I don't want to wish that upon anybody unless they have to be. Like, I don't want to wish that, but it's almost what you want to wish like they could take a step in our shoes for a day, just walk in our shoes for a day. What it feels like to have hip pain for a day, just almost what it feels like, or what it feels like to be frustrated on the phone with insurance for a day, which I'm sure they understand that. But what it feels like to be, out of pain meds or just all the little nuances of things. And and I think that's what I kind of wish that they could just step in our shoes for a day, and then I think they would be like, oh, okay, I get that. Like, we get it. We got you.
Going back to what you said about how you feel like you were not fully prepared for what you were walking into, do you feel like there should be more education for patients preoperatively to say, like, this is what, and again, it's difficult to really do if the medical professional has not been through the recovery. Right. But I agree too that when I was going through my first PAO surgery, there were a lot of things that I felt like it would have been really nice to have a heads up on and to say like these are normal things to expect. For example, after a PAO surgery, for the first few weeks, if you sneeze, cough, anything like that, because of the muscles that they have to detach and reattach during the surgery, it's excruciating to cough or sneeze, and I wasn't given a heads up. And so the first time I sneezed after surgery and I felt like my pelvis was being ripped apart, I was like, oh my gosh. And then I went on social media and people were like, oh, that's expected, that's normal. You should hold a pillow over your hip for the next few weeks. And that made it feel a lot better. But things like that in navigating your recovery, where it's like the things that medical professionals, unless they lived through the recovery themselves, it's difficult to like fully prepare oneself. But what are specific aspects of your recovery that you had wished you were like better informed on going into it?
I think even just the pain management of it, because I was like not aware of any of it. I mean, because I didn't know anybody. He was just like, we're going to do this, we're going to pin it back. You'll be fine. You're an athlete. You'll be back in shape in no time. Like, no big deal. Like, he acted like it was nothing. And I swear I thought I was going to die. And and he did not like, and mind you, obviously this was not the good surgery, which were like night and day differences when I had my my first PAO that was done unfortunately wrong was done like in a night and day difference than my good PAO. My good PAO, I got to feel the good aspects of what it was like to have proper pain management, to have a surgeon who visited every day, a surgeon who cared, who came in and checked like my wound vac and made sure my incisions were like pristine because of my classical EDS. We wanted to make sure like incisions were not coming apart. And so we were extra careful on some of those things. So it was just a night and day difference. But when I was just getting started in the journey in 2009, I had no clue. And so when you're telling a patient that has never even gone into an OR to begin with and stayed overnight in a hospital, and you're like they could have told me heads up when you go into the OR, there's going to be a lot of people and a lot of things going on. Not even that, not even that was going on. I got rolled into the OR. There were two tables, two surgeons, like 20 people. I literally panicked and started sobbing. And they were like, just put her out on the table, like, put her out right now. And like, it was that bad. And so I was like, okay, like, let's let that be known that that's just not how it goes. Like we can do better than that, people.
Wow, I'm sorry you had that experience. And I think it certainly highlights the need to understand where your patient is at. Having a patient who has never had a surgery before, there are absolutely things that you need to prepare them for. And it's so unfortunate because it can be really traumatizing for a patient to go through those things feeling scared and anxious, and it's such an unknown environment, and to not feel supported when you're going through such a life-altering experience is just so unacceptable. I'm glad that for your second PAO, you were able to be with a team who you felt better supported by and who really addressed the ways that the first team fell through.
It's shocking, like to hear some of the stories. Like when you hear some of the fail stories versus some of the success stories, it is just shocking. Like shockingly, like it shouldn't be laughable, but it's like shockingly laughable, like how bad some of these have gotten. And it shouldn't be. And care shouldn't be like that ever, to the point where it is just so disheartening and deplorable that you're like, the only thing I can do is either laugh or cry, like about the
Truly.
situation. Um, and for me at the time, like I just didn't know how to handle anything. So I cried. And of course, now 50 surgeries later, like I could roll me into an OR with 50 people and I'd be like, okay, whatever. Um, but that's taken obviously a lot of work and time and torture to get through that point. No one should have to go through that. You know, a doctor should be able to tell you, hey, this is what's going to happen. And I think different hospitals and different facilities and people are way better at it than others. And if your facility is not good at doing that, then you need to be good at doing that. If that's what you're doing for your patients, is that you need to inform them. And if you can't do that, your office needs to make sure that they're informing them. Like your team needs to make sure that they're doing the job and getting the job done. Um, it just it's just unacceptable to not have a patient prepared in the day of 2025. Like,
Right, right. And I think we talk a lot about patients being advocates for themselves, but also medical professionals should be advocates for their patients.
yeah.
And when you look at the type of experience that you had, mental health plays a huge role in recovery and how you navigate future medical experiences. And so if you had that experience going into your first surgery, that could inform your decision to maybe not pursue additional surgeries because you're like, wow, that was a really terrible experience and I can't go through that again. I'm sure that there are patients out there who had a really bad initial experience and that's preventing them from pursuing additional treatment that they may benefit from. And so I think it really falls on medical professionals to also be advocates for their patients to make sure that the patients understand what they're going into, to make sure that their questions and concerns are answered, and just to be a support for them on these big days. When you're having surgery, it's like, at least for me anyway, surgery day is a big day. There are a lot of emotions that go into
Yeah.
that. It's just like this very visceral feeling. I can like feel it just like thinking about it in my stomach. It's such a vulnerable place to be, and to not have support and guidance from your medical team can alter the whole patient's experience and then their later outcomes as well. So, thank you for sharing that. And again, I'm sorry that you went through that.
No, I totally agree with you about mental health. And I think mental health should be a bigger part of a lot of teams' approaches. And they're starting to be, fortunately, to be part of the team approach to care in a lot of these situations, which is a beautiful thing to see because they've been a part of like I think heart health and kidney health and different other diseases programs for decades. And we're just now starting to see it being used in other departments in that manner because it's so successfully used, but it's also so needed. And I've seen a therapist for years, not only because of what I've been through, but because of what I continue to go through and the need to be able to cope and manage with all of that. And no one should be able to have to do that alone. To have an objective source that is supportive is in like undescribable and just the most amazing thing to have. Um, Everyone should have that support if that's what they want. But I think it's wonderful that these departments and these hospitals and clinics are starting to move in that direction.
Absolutely. And even, not even preoperatively, but also postoperatively,
Yeah.
to be able to support patients through the emotional and mental ups and downs of recovering from surgery because there are highs and there are lows. And to have that kind of mental health support is really important. And I have seen also, there are studies that have come out in the last year or so about how mental health impacts recovery afterwards. I'm glad to see that it's a topic people are interested in looking into now, especially in the orthopedic population where you have patients with chronic pain. I mean, it's just so mind-boggling to me that, especially in the chronic pain population, mental health has not been talked about sooner. Because when you look at anxiety and depression rates among patients with chronic pain and complex orthopedic conditions where they're going through surgery after surgery, it's just such an important aspect of it. And as with some of the things that we talked about earlier, I think a lot is changing and evolving, and I hope that in the future it's standard to have that mental health support preoperatively, postoperatively, and really at any time that a patient feels like they could need it, because that could come up at any time during a patient's journey. But kind of going off of that, when you shared your experiences with that first surgeon, I think finding the right surgeon or care team is absolutely critical. And so, what advice would you give to other patients about identifying providers who respect and include them in their care decisions? And what was that journey like for you?
I've kind of come up with almost like a physician formula to like figure out like how like what works for me. And like they have to be willing to answer your questions and answer like how many surgeries they've done, how many times they've done this procedure, um, where they've studied at, especially if they're a new doctor, like I've never met them before, like where they've studied at, um, what was their specialty in. And if they're not willing to even answer those questions for me, red flag right off the bat. Like unwilling, like not participatory, like I'm not going to do this. Like that's a huge no for me. Um, or if they just are like, um, email me later, like I feel like that's like kind of also a red flag that they don't want to take the time to just sit and answer my questions. Um, for 5 minutes, if they don't have that time to give me a face to face, I feel like that kind of shows lack of patient contact as well. I know they have time, only so much time, but when you're meeting a patient, like you gotta give some time. um, I also look at where they've trained, what they've trained in. Are they specialized and fellowship trained in that specialty that I'm getting that surgery in? So, like, if I'm getting shoulder surgery, are they specialty trained in like shoulder arthroscopy? From what specialty clinic? Is it a top rated clinic? Were they top ranked in their class? Just details like that. And I get really kind of nitty gritty about it. Um, I don't know, not everyone knows how to get into those details and like, or wants to know some of those details, but I think it matters to me, like, especially if they're certified and trained in that particular fellowship, like if they're fellowship trained is a huge key like flag for me. If they're not, I don't want them operating on me if they're not like specialized in that field. If it's just general orthopedics and they are just trying something, and I'm like, no. And it's so hard because after having doctors like Dr. Millis, who are some of the world's best and spend hours with you, and also are the world's best of the best when it comes to hip surgery, I feel like I've been forever um like tainted when it comes to like and spoiled when it comes to picking out surgeons in any other specialty or hip surgery, because then I expect everybody else to be to that standard. And I feel that if anyone else can't be, that it's unacceptable, because if he can do it, why can't you? So that's just a little bit of how I kind of choose what I choose. And then I have, for my PAO docs, I have like a PDF list of questions, and I give it out to anyone who wants them. And it's available on the group. I can also have Lauren link it too, for anyone who's wants to send it, and it has a lot of the same questions, like where did you study, how many procedures have you done, um, and just kind of those kind of questions, and then it goes into details of questions about the surgery itself. So um, I'll I'll share it with Lauren for the crowd.
That would be great. And what you mentioned about finding the right care team speaks to how every patient is going to have their qualities in a team that are most meaningful to them, and that will be unique to every patient, right? And so before going to meet with a doctor, really taking time to reflect and like think about what is important for me to convey at this appointment. What do I want the doctor to kind of reciprocate back? And if you feel like the medical provider is not, meeting those qualities that you really value in your care, then it's absolutely encouraged to go and get a second opinion, third opinion. Nancy Muir, on her episode, she talked about how she got a 39th medical opinion. And um, you can never be too cautious, I think, with taking the time to find the team that you're most comfortable with, because that team is going to be the one who is, helping you to make big decisions for your care and for your life. Taking the time to really know what's important to you in that and taking the time to find those providers who you feel most comfortable with is really important. And I think it plays into having better outcomes as a patient if you feel confident in your team and you feel like you're with someone who's like the best fit for you.
Oh, for sure. And I tell people that all the time, that not every surgeon is going to get along with every patient and vice versa. So you need to find what works for you. And that may not be what works for me. So, just because like, so and so is a great surgeon for me doesn't mean that, if you had a bad appointment, doesn't make him a bad surgeon, but also doesn't mean that there's something wrong with you either. It just means that you maybe haven't found the person that fits for you yet.
Right. And I think it's just, I heard an analogy one time about how it's kind of like looking for a wedding venue that, everyone goes to view multiple venues before they make a decision. So why should it be any different when you're, putting your care into the hands of someone else,
Very good analogy. I like that. Especially
Yeah,
when it
I
comes to
thought
yourself, like that's like the ultimate like venue.
it really is. Yeah. Totally. Um, Now, it sounds like you have had very patient-centered experiences and other experiences that have not been patient-centered. So I'd love to know, what does patient-centered care mean to you? How have you experienced it or not in your own care? And, what are ways that you've advocated for yourself in medical settings through that?
Patient-centered care for me is, I think, is almost like self-explanatory in that definition for me anyway. Um, and I think like a good example of that was when I was a patient at Boston Children's, and I had my femoral osteotomy surgery there with Dr. Millis, and they did everything from like hold your hand down the hallway to making sure my mom had her luggage, and like took her to get her luggage to the proper room. And it was actually Dr. Millis who took the luggage to the room. So it was actually really entertaining. Um, but and it was everyone from the janitors who said hello to you to the your PT, and every single person was there about you and about your care experience. And I think that's what made the care so amazing. I don't think I've ever had a place that has had better care than Boston Children's. And there's a reason they're number one for a reason. And I know you know that. um, and that so many people that listen can probably attest to that as well. Um, but I've also had facilities that have not been patient centered to the point where I, because I was advocating for myself, I knew too much. I was accused of having Munchausen's because I knew too much as a patient.
Mm,
So I've had from one end of the spectrum of amazing all the way to the other end of the spectrum of absolutely horrid. So it just, it really is, you run the gamut of what you can get in the medical system. So, um, patient-centered care really should be about patients and the benefit and the results that they need to get out of the care.
absolutely. And I think it is also, at least for me, it's about really like looking into and addressing the social, emotional, mental health of the patient in addition to their physical health. Focusing care practices around all of those aspects. Because if you have a patient who feels supported and who feels like they are being cared for in like all aspects, and or at least I don't think it's necessarily the role of a medical professional to provide the social support for patients or things like that, but at least providing the resources for social support and the resources for mental and emotional support. That's what, patient-centered care means to me. And kind of going back to what we said earlier about valuing, understanding patient values, because every patient is going to have different values in their care, and understanding how patients want to be included in their care, whether it's a patient who kind of wants to know every detail of the surgery that they're about to have, or if they're a patient who just wants the most important information to make a decision and they're not really interested in like all of the minute details. I know that for me, I am the type of person who wants to know everything and I want to watch a video of the surgery before I have it. And I had a feeling you would too.
Me, me, me.
Yep. And again, that goes down to like knowing your patient beyond being like knowing your patient as a human being and as a person beyond being a number on a list. So I think you described it so well. And it doesn't always have to be doctors bringing your family's luggage up to the room. While that's like such a sweet sentiment and absolute, like it's amazing, there are other ways that like doctors and other medical professionals can show that they're patient-centered and that they are really there for you throughout all aspects of your care that will still be
I
meaningful to patients.
I even had just one doctor, like after I think rounds, evening rounds, he came in. I was in the hospital for an infection, and he came to check on me, and he just came and he sat with me for like 10 minutes, 10, 15 minutes, and just sat with me. And the nurses were like in shock, A, because he was cute, because he was an ortho doc. So they were all like googly eyed over him. And and the other aspect was that he was so nice. He was just genuinely so nice. He thanked all of them, and he just sat and just chilled with me for like 10, 15 minutes and just wanted to see how I was doing. And I just took that, like, that meant so much to me, just to just he just took the time. Like, it wasn't a ton of time, and it wasn't like a huge deal. Like, it's not like he brought me flowers, but it was just the the thought and the gesture of it was such a huge thing that I always remember about that hospital stay.
Well, and it's really those moments when I think about my care too. It's the moments that it might feel relatively small to the person doing it. But for us on the receiving end, it's like, wow, you really put a lot of thought into this gesture. And, I remember I had an anesthesiologist before one of my hip surgeries, and he came into my pre-op bay, and he sat down at the end of my bed, and he was just and he put his hand on my hand, and it was just so like comforting. I really felt like it was just like a human connection, and he was speaking directly to me, and he would turn to my mom and ask if she had any questions, like, throughout, but he was speaking directly to me, and he like really took the time to answer my questions, and we had a really lovely conversation because at the time I like wasn't tolerating anesthesia well, and so I knew that I was bound to have kind of like some complications or adverse effects afterwards. And he came and visited me every day that I was in the hospital to like ask how I was doing, to come up with a plan for any of like the adverse effects that came up. And every time he visited, he would get down to my level and he would just speak to me in such a way that really made me feel like it was like just him and I, and it just was so caring and thoughtful. And like you said, it's like he probably doesn't think twice about it, and that's just
Yeah.
how he is. But I think about it years later.
I even had talked to that surgeon previously because we're still friends, and he's like, "That's just how I am." He's like, "I don't really do anything that's extra nice." He's just like, I just do like the normal things." I'm like, "But it's the normal things that are nice that people really like, and it's the normal things that patients aren't getting." And that's the problem. And I think that's also the big deal, that when we do get them, is that they make a huge difference. And so that moment, just sitting and hanging out with me for 10-15 minutes, was a big deal, just in that hospitalization, when parents can't be there all day, siblings are, you're in college, they're not there, like it's just so you're there by yourself a majority of the time. So when someone comes to see you, it it means a lot. So I was like, it was really cool that you did that. And he was like, oh, I didn't, he's like, didn't even think twice.
I found that too when I have expressed my gratitude for doctors who do like some of those, who just that's how they care for patients. And I'm like, thank you so much for doing that. That was really thoughtful. And they were like, kind of surprised that I was thanking them because again, they were just like, "Oh, that's just, I that's how it should be, you know?"
Yeah.
And so yeah, it's really cool to have those moments and just know that there are medical professionals out there who understand how important and how meaningful that is to patients.
Yeah, absolutely.
Now, I'd like to kind of switch gears to more of your advocacy work. You're involved with Miles for Hips, and you are such a strong peer mentor for those navigating PAO surgery. What motivated you to get involved in this way, and what does that involvement mean to you?
I think the biggest reason was just the lack of education for me, and I didn't want that for others. And so I just, as I was navigating my journey through the rest of like the hip like stratosphere, I was also learning other things that was helping other people. And so I would just include other people in that. And the more I learned, the more I would share. And I just kind of stuck around because I was like, well, I've done this so long, like I can help others. Like, well, why not? And at this point, like it's been so long, it feels like I'm kind of like almost just holding the door opening for someone, and just kind of keeping that open, and being that knowledge base for someone, or paying it forward in a sense. Not necessarily that someone did that for me, but just maybe starting it for someone else. And they do that for someone, and I'll get that from people like, how can I thank you? And I'm like, do it for someone else. Next person you see or the person you meet, pass it on. I you don't have to thank me. Like, it's okay. Like, I did it just to help other people. So, um, that's really all I've ever wanted, was just to help other people. So, and I think that's the biggest thing for me.
I love that. And like we talked about earlier, having social support from others who have been through either the same or similar surgeries is such a powerful tool and a resource because that's a perspective that most medical professionals cannot provide. And when you have patients, they're in the midst of their recovery and whether it's the mental health aspect of it or they get home and they are like, "Oh my gosh, I don't have like the appropriate equipment or like OT tools to navigate the house to do like activities of daily living after a surgery." Those things that only patients really understand because they've lived it. Like I see in the PAO group a lot patients asking like, is this a typical thing to experience after the surgery? Or even preoperatively, I think there's a role for the peer mentor support that you provide, which is that, this is how you can successfully set up your home for when you get home from surgery. And these are tips for how to set you up for the most success, like meal prepping and putting meals ahead in the freezer so that you have something easy to make when you get home, or making sure that you have appropriate family or friend support, someone who will be home to help you with like crutches or a wheelchair and things like that in those early days of recovery. Like, understandably, medical professionals don't have the time to talk about all of that. But what's really wonderful is that with social media now, patients can turn to that and be more prepared preoperatively and then also have that support afterwards because of people like you. So it's just,
Absolutely. Thank you.
yeah, yeah, you're welcome. I mean, it really does. I think about a lot of my earlier surgeries, and my parents and I navigated that alone. There were not support groups on Facebook or like people to reach out to who had been through similar or the same surgeries. And it's almost like when you're in it alone, it's like you're in a fight or flight response and you're like, you just have to survive, the next
Yes.
however many days that you're really kind of in the trenches of recovery, and you're, learning the ways that you can and you can't move around the house. And you're just like discovering that there are, you have limitations post-operatively, and like how that impacts you at home, and that's something that when you have to face it alone, it is scary and it can feel isolating and overwhelming and impossible at times, honestly. And so now in recent years with social media, being able to have someone who can like really set you up with resources and tools and the ability to be more successful without having to do that alone is just like it's awesome. And again, I think knowing that you have the support from others makes a difference in a patient's recovery and how they are able to go about their recovery.
Yes, I completely agree, and I love that about social media, that it has given that ability to give a handhold from like across the country at the fingertips of a cell phone. And I've met some of my like, and people have even asked me like, do you regret having a PAO that failed or was done incorrectly? And I surprisingly will tell them, like, they're surprised at my answer, and I will tell them no, because I wouldn't have had the experiences I've had and met the people I've had I not had said experience. So like some of my best friends live like on opposite ends of the country than I do. In like California, New Orleans, and like North Carolina, and like all over the country. And I live in the middle of the country in Indianapolis. And my doctors are all over the place, obviously, like Boston being one of them. And I wouldn't have had some of the opportunities and be able to do the things that I've done and help people that I've been able to do without this. And I think that's such a beautiful way of like making um lemons out of lemonade out of lemons, but also watching something beautiful come out of something broken.
Yeah, I feel similarly when people ask me about do I regret going through, say, like limb lengthening versus some of the other treatment options that were presented at first, or but I wouldn't be the person I am today if it wasn't for all of
Mhm.
these
That's
experiences that I've
thanks.
had. And
Yeah.
like you said, the people I've met, the medical teams that I've had the privilege of interacting with, and you can learn something from every good and bad situation. All of these things that ultimately inform your perspective on the world. And I think it can be a beautiful thing.
Yeah, absolutely.
I also talking about Miles for Hips and how you're such a strong peer mentor. I wanted to spend some time to just talk about how Miles for Hips helps to bridge the gap between patient and provider and providing reputable resources for the hip dysplasia community because as you said earlier, there haven't always been the resources that are available to the hip dysplasia community as there are now. So there's been a lot of growth in that area. And I think that Miles for Hips helps to address that in a really powerful way.
Yes, exactly. We do address that. For example, we have done articles from um, like hip acronyms and terminology to what are angles and like what does all of this mean when you get um, the CT and the imaging reports back. And what does all of that mean? What does all that terminology mean? What does the angles mean? And we have done a paper on all of that and kind of a breakdown to in layman's terms so that you can understand from the medical perspective to the patient perspective what the basic terms mean so that when you read your reports, you can be like, oh, well, the lateral central edge angle is 30. That hip is not dysplastic, or that one's mildly dysplastic, or whatever it may be. Um, and we've done ones on Pavlik harnesses for babies and the history of the Pavlik harness, um, which was a recent one I did. And it's just, so it's just pretty incredible taking resources from what was actually a conference that I took Dr. Salil Upasani's work on the Pavlik harness and got to break that down and to bring that forward so that patients got to see that information from one of the international hip symposium. And so it's just really nice to be able to bring and bridge that gap from a lot of the historically professional areas to the patient perspective. Um, and we also get to do a lot of patient advocate work with, well, it was IHDI, International Hip Dysplasia Institute, which is in a transition period. Um, and we do fundraising, which raises money for research and education. And we do t-shirt fundraisers every year, which garner a lot of support, as well as our Day of Movement, which brings awareness to communities about hip dysplasia, and not only through our t-shirts, but through just getting out there and being a presence in our community about hip dysplasia. So I know Lauren's done stuff in Boston. We have a pretty large community in the Denver, Colorado area, Texas, Florida, um, communities all over the US. So if anyone's ever interested in anything, we'll put the links for you for Miles for Hips. Um, if you're ever interested in volunteering or if you want to learn more about research opportunities, we're always taking on volunteers for research. Um, that is something we always are. Lauren and I always love volunteers for research. So we'll take you on. Um, and we'll always take on anyone who wants to tell their story as well about their hip journey. That's another thing we do, is that we spread people's stories and the different kinds of stories, from um, infant and child stories to family stories to individual stories. Everyone's stories get shared on Miles for Hips. So if you have a hip story and want to share it, please bring it to our attention. We'll put the links below.
Absolutely. And what's most impressive to me about Miles for Hips is how it has grown to become a really reputable and reliable space that even, hip preservation surgeons are recommending patients to come to Miles for Hips to not only have that, like more of that social support, but also the resources that are provided help to dispel a lot of the misinformation that's out there about hip dysplasia. And there is a lot of misinformation. And so it's really neat to see that even the, medical professionals in the field of hip preservation are recognizing Miles for Hips as a valuable resource to patients.
Yeah, and it's because we don't use any one center as for bias. We use a team of providers that are just a medical overviewer for our information, that just strictly uh, critique and look at the information for bias and for misinformation. Is it accurate? Does it have any bias? And and if that's corrected, then we put it out to the public. And so that's what I think makes us unique, is that we're not really funded by anyone specifically. So we don't have to have an agenda per se, which kind of makes it nice. So that's kind of a nice thing for us too.
It is. And as you said, I'll provide links down below so listeners can check out what Miles for Hips is all about and see the wonderful work that's being done in the hip dysplasia advocacy and awareness and education space, because it's really exciting to see, and I know it's just going to continue to grow from here. So I would definitely encourage anyone who is not familiar with Miles for Hips to go check it out. And as we near the end of the episode, do you have, what should medical professionals understand about the hip dysplasia experience and what is important to patients in these often complex and long journeys?
I think for medical professionals and for patients, it's to really take things one step at a time, and to really like focus and look thoroughly at situations. Um, Maybe more so for the medical professionals, on the thoroughly take one thing at a time, but even for the patients, to take a deep breath, to remember to take a deep breath. And I always kind of tell people that I'm helping to coach or advise, I'm like, take it, like, first of all, take a deep breath, because we will get through this. Like, you will get through this. Like, just one step at a time. Like, you just kind of have to put one foot in front of the other, baby steps. And for providers, I think it's just so much more than being thorough and meticulous, but also being empathetic towards your patients, and remembering that we're still your patients. and not just a number or a scientific research journal article, and that on the other end of that scalpel is a person, and that we really need to feel secure in what you're doing. So, especially for those new up and coming surgeons, and I know there's a lot of new PAO surgeons out there. So, just to take the time, get to know your patients, it makes all the difference in the world, those connections.
That's the perfect advice, and it beautifully encapsulates what patient-centered care is. And it's just such an important aspect of not only the hip dysplasia experience, but any patient undergoing any kind of care or treatment should be treated with patient-centered care. So thank you for sharing that. And this has brought us to the end of the episode, and I just want to keep talking because your insights, and you've obviously had a lot of experience as a patient, and you bring a really incredible perspective that patients and providers can learn from. So June is Hip Dysplasia Awareness Month, and so I'd love to chat more then and hear more of just hear more of what you have to say because this has been an incredible conversation, and I know that there is a lot more to be said and a lot more for other people to hear. So, um,
I'd love that.
awesome. So. For this final segment, I am calling it Memorable Moments, and this is just kind of a time to share a recent reflection, a piece of advice, or like a meaningful anecdote from our experiences as a patient that has stuck with us. And I feel like some of the experiences that we shared earlier could, count as this. Just we've certainly both had many memorable moments in our care, but if there was one that really comes to your mind that you want to share, this is an opportunity to do so. And I'm happy to go first if you want, or if you want to take the lead, you can.
I think I'll share a quote from one of my favorite authors.
Perfect.
C.S. Lewis is a favorite author of mine. He wrote Chronicles of Narnia, among many other things like Mere Christianity. Um, and the quote goes, hardships often prepare ordinary people for an extraordinary destiny. So I think that's a beautiful sentiment for a lot of people and a lot of the journeys they face. And I think our journeys, especially. Um, and I think a lot of people can relate to that.
I couldn't agree more. And I think that touches upon how hardships can really change your perspective on life and your outlook on just day to day and really appreciating what may seem like seemingly mundane moments, but they really can be powerful and impactful. And I think it's true that people who endure hardships can they can grow so much from those hard experiences, and that's a beautiful thing. I think my memorable moment would be I recently saw one of my surgeons who has kind of been involved in my lower extremity care more recently. This wasn't the surgeon that I grew up with, but as a surgeon that I grew up with is kind of semi-retired and going towards retirement, I started to transition my care to someone else. And I recently saw him to show him the device that I have for my leg that gives me mobility and it allows me to walk pain-free. And anyways, I recently saw him and he was so fascinated by the device, and we had a really great conversation about how there are a lot of barriers to patients accessing devices like this, and how there's also just not a lot of awareness about devices like this. And he took it upon himself to create a presentation for his colleagues to learn about the device for those who had never heard of it so that they can have it in the back of their minds and, have it in their toolbox to refer other patients to. Um,
That's amazing.
yeah, and I just thought it was so thoughtful again that he recognized that this could help such a larger population of patients, but so many medical professionals and patients alike are not aware of the existence of a device like this. And he is really kind of advocating for more awareness because there are patients who, my next step, I was going to be facing another foot and ankle reconstruction that we were not confident was really, it was really up in the air as to whether it was really going to help. And there are so many patients who are facing, limb salvage procedures or just a lot of, not great options for their certain limb dysfunction. And so to have more people who are aware of this device that is really life-changing for patients in that situation to be able to say maybe surgery isn't the next step. Maybe it's getting this device that can provide more support. And I just thought it was so cool to have a doctor, to have a surgeon, who he he became a surgeon because he loves doing surgery, but to recognize that there's this non-operative option available and to advocate for that and to bring that to more patients, I just thought was incredible.
Yeah, and that's just incredible to me. That is really incredible.
And it
That's
speaks
awesome.
to, and I think it speaks to the role of medical professionals being advocates for their patients.
Yeah,
Like when you recognize that a patient's best option might not be surgical, to say, well, there is this other option that unfortunately not many people know about, but to say that he now has a patient who had a really great outcome from it, to at least present it as an option to other patients, because I found out about it on social media and am I just think about how lucky I was to like make that connection with this person, but not every patient has social media, not every patient is gonna like have that connection. And so
right.
to have this doctor kind of like bridge that gap to say, I'm gonna be that connection so that you can really understand all of your options.
That is amazing because DME equipment or durable medical equipment, for those who don't know what DME um, is A, not cheap and not easily like accessible, affordable, um, just anything with regards to insurance, but then just even knowledgeable for this in regards to surgeons and doctors. It's hard to understand. And so the fact that he took the time to do that is really heartwarming. That's really awesome.
Yeah, it really heartwarming is the perfect word for it. I was like, it's just so meaningful that he saw, he sees that there's a greater benefit and he's willing to kind of take that stance and um
Practical need and be like, I'll be here for this. Like I'm here for this.
yeah.
That's so cool.
So definitely a lot that patients and providers can learn from everything that you
Sure.
shared, Ashley. And
Thank you.
yeah, you're very welcome. I'm so glad to have had you on today. And again, I'm hoping in June, Hip Dysplasia Awareness Month, we will continue to share your story and continue to share your patient perspective. So thank you so much, Ashley. This was really wonderful.
Yes. Thanks. Thanks, Lauren. I appreciate it. Thanks,
Yeah.
everyone.